obsessive compulsive.
You know people really like that?
Yeah, I do. I like this. I like this picture of obsessive compulsive. It's like the perfect yard, just everything's done. And my grandmother was not obsessive compulsive, but she had a fit about her yard, and it was supposed to just be mowed perfect. Just look, we lived out in the rural areas of Alabama, but her yard was perfect. And she would sit there, and if a seed head would pop up in her yard, it would be perfectly okay. She would just go, "There's a seed head out there. There's a seed head. Somebody needs to go mow it down." And we were like, "Relax." I would see if I could pull them up so she wouldn't say anything, but she wanted her yard perfect. Okay, that's why I put that up there. Does anybody know anybody with obsessive compulsive disorder? Like, I mean, really a diagnosed disorder? Okay. Can y'all say anything about it, how their life is?
I know when it's my older brother, I know when he vacuums because the patterns in the carpet are ridiculous. Like I went over there last week, like this past weekend, and I knew he was the one and not his wife was the one that vacuumed because the patterns in the carpet.
Does he actually have the diagnosis?
He won't go see anyone for that.
Okay, so he's got, but you think his behavior is off enough?
He does it with his lawn too, like his grass is in perfect patterns.
So it's the way, it's not only the fact it's mowed, it's how it's mowed has to be a certain way.
So my mom has obsessive compulsive disorder, and growing up watching her do the things that she was doing, she would do everything from taking all of our toys and bleaching them literally every day, being very germophobic still today, even with pharmacotherapy and behavioral help. She still uses like napkins when she goes to like a buffet or touch door handles. She is an extreme germaphobe too. It really threatened her everyday life.
So it's debilitating.
Yeah.
Can be a mess. Okay. Yeah.
I know someone who, you watch them check the lock on the door like, 5 or 6 times until you're like, it's locked, Or
Yeah.
if you're drinking a cup of water in their house, like you just set it down and you're not even done with it, but it's done and washed. And you're like, where'd my cup go? I was drinking out of that, And it's like, oh, I thought you were done with it, like just had to.
Isn't that incredible?
Yeah, it's weird.
It is something. Yeah.
My boyfriend does not have OCD like diagnosable, but he has some tendencies, and one of his things that's kind of his like obsession is that he's always anxious he's going to oversleep. So he will set 5 alarms every time. They're 5 minutes apart, and he checks it. He makes me check it, and then he checks it again, and then I will like catch him, and then like when we're falling asleep, he'll look over and like check it again, and then check it again. He's really OCD about them being on.
But not that.
Yeah.
Paul was telling me about this locking doors. Okay, you talking about locking doors in the house, you check them. I do this every night. I will go around. I know the doors are locked, but I just have to go back one more time and check them. I don't know why I'm thinking that, but I do that. And the one I used to, and I'm not OCD because I don't have all the criteria for doing that, but one thing that used to drive me crazy is I burn candles in our house because we have dogs, and it just kind of just changed the quality of the air. And I would always blow the candles out before I would leave the house. But when I'd be telling them coming down here, I would be 5 minutes away from the house, 10 minutes away from the house, and go, I didn't put that candle out. If I didn't put it out, the house could burn down. If it burns down, I'll kill my dogs and I will die. I would have this whole little chain of thoughts that kind of went with that. And so I would turn around and go back. And I didn't want to open the door because if you open the door, then all of a sudden they're all excited like you're home again. And so I would look through the window to see who's out. They'd bark thinking I was an outside stranger, but if I opened the door, then they would think I was home for good. Then I couldn't just say, okay, the candle's okay, y'all go away, I'm going again. They just get too freaked out. So I've done this before there, I've admitted it. Take me to therapy, please. Okay. Obsessive compulsive, there are a number of obsessive compulsive and related disorders, and we're only going to look at one because I think it's typical. But obsessive compulsive disorder, body dysmorphic disorder is part of this diagnostic category, and we're going to look at that on Thursday. I've kind of put together all the somatic body things in one location, but it truly, by the current definition, falls under obsessive compulsive. Hoarding, we've all seen the program on TV. That's an obsessive compulsive disorder of being unable to get rid of things for irrational fears. Trichotillomania, hair pulling. I've had patients who've had this where they pull hair out. There's the other side of this one is excoriation, is a diagnosis, skin picking. Just pick yourself apart over time. It's just weird. Okay, and then you have all the same old typical substance medication-induced OCD, obsessive compulsive and related disorder due to another medical condition, and then other specified, that's kind of a grab bag. You can't really fit the criteria up here. But let's look at this. Obsessive compulsive is characterized by obsessions, compulsions, or both. You don't have to have both to have it. You can have obsessions, you can have compulsions, but most people have both obsessions and compulsions. They are time consuming, that is, take more than 1 hour per day. I guess I just diagnosed myself. I spent 1 hour blowing at candles and going back and looking through windows. Or they cause clinically significant distress or impairment in social, occupations, or other important areas. They are not attributable to the physiologic effects of a substance or another medical condition. So obsession, compulsive, time consuming. Obsessions. I gave you a definition earlier, but let me give you the DSM-5. It's a little more extensive definition. It's recurrent and it's persistent thoughts, urges, or images. So it could be something you're thinking about, something you feel a drive to do, or a picture that you have in your head that are experienced. At some point during the disturbance, they are intrusive and unwanted. I can't get that out of my head. I can't stand it. I don't want it anymore. And they are aware that they don't want it, but it just keeps flooding in. It just comes back over and over again. Causes anxiety or distress. Individual attempts to ignore or suppress such thoughts, urges, or images, or to neutralize them with some other thought or action is what's going on. That's called by performing compulsion. So you have an obsession, so you can make the obsession go away by performing something repetitively. So people try to distract themselves, and that's why compulsions usually fit with obsessions. You try to not think about the image because I'm doing this other thing over here. Now compulsions are defined by repetitive behaviors. So obsession, a thought, an urge, or an image is kind of an abstraction, something you can't really grab hold of so much. And then a compulsion is an action, hand washing, ordering, checking. What I described about the candle was an obsession, was a compulsion, but it also kind of is an obsession too, because I have the persistent thought that my house will burn down and my dogs will die if I don't go back and do that thing. So maybe my compulsion is a compensatory action against that obsessive thought, that I've done that. So it's repetitive behaviors or a mental act. Okay, for example, praying, counting, repeating words silently. Okay. I'll tell you what. Just to kind of describe it. I have levels of obsessive compulsive, but it's not at a disorder level. But when you're studying, when you get into a study mode, there's things you have to do, and I will repeat things over and over. And if I've got it down, I'll have to do it again. And I've got it down, I'll have to do it again, and I just repeat and repeat before you do a test. Now, I don't know if that's just the anxiety of the moment, the pending moment, but in so many ways for me it's not. I have to study a certain way. I cannot study in a room that's disorderly. I cannot stand it. I mean, you asked Dr. Latesky, if I'm really doing something big and I have to get ready, then you got to get out of my space. Do not mess up this space. I want this thing organized. Don't touch anything. Don't mess with these papers. It has to be arranged like this. Get out of here. You don't understand. Because I have a hard time thinking in disorder. If I'm trying to organize a bunch of things in my head, I've got to be in an organized space to do that. If there's chaos in the room, I find it hard to organize thoughts. So that's just me. Okay, so do I have a diagnosis yet? I'm getting closer all the time. And the individual does is driven and performing in response to an obsession or according to rules that must be applied rigidly. The behaviors or mental acts are aimed at preventing or reducing anxiety or distress or preventing some dreaded event or situation. So I actually probably do have an obsessive compulsive disorder, but I don't think I'm there yet. These are not connected in a realistic way with what they are designed to neutralize or prevent, or they are clearly excessive. Okay, I'm not there. And mine actually are designed to prevent something, I mean, that's meaningful. It's about 1.2%, Women are affected at a slightly higher rate than men, although males are more commonly affected in childhood. Mean age of onset, again, early teen years. It's like most things. When the brain becomes developmentally full, it's done, you begin to see what it's going to do and how it's going to respond. Onset after age 35 is unusual, but it can occur. It's like a lot of the disorders, gradual and not abrupt. So they were here 1 year, and then 2 or 3 years later, they're doing all this stuff. It's chronic with waxing and waning symptoms, which means that sometimes it's more of a driver of your behavior than other times. Remission is low without treatment, which means if you don't do anything about it, it's going to be there. Okay, living with OCD.
Eight. That's how many times I have to blink after waking up to a day full of very, very strange rituals. Now, careful not to get out of my bed with the wrong foot, and I am off to some algebra. 1, 2, 3. 1, 2, 3. Most people think that OCD means obsessively washing your hands and trying to align everything. Trust me, things are about to get a lot more fucked up as we carry on. Now it's time to attempt cleaning the house. I start by lifting my hand off the doorknob using a very specific slow movement. I enter the elevator and I stop it, obviously. You didn't think I'd leave without checking the door, did you? Don't be silly. I'll be back. At least twice. Yeah, there it is. I go down, I enter the car, doing pretty well so far, no intrusive thoughts for the past 30 seconds, think I'm going very combo here. And then Mr. Satan comes along and whispers into my ear, "Did you check the window step lights, Bob?" And I reply, "Yes, Mr. Satan, I did. But I have to go back, and I have to check, otherwise I get the feeling something terrible might happen." I love to eat, but I am pretty sure that if loaves of bread with unevenly spread butter were the only food available on earth, I would starve to death. I also avoid certain meals, just because they have a weird texture that reminds me of worms, and I have to touch specific objects many times until it feels just right. But now that I think of it, that sounded weirdly sexual, so please don't take this out of context. Anyway, here comes the messed up part. I get these terrible urges to ride up the road, hit a tree, jump off the bridge, run over my ex-boyfriend, and then I am sitting there wondering, am I really capable of doing all these things? I don't want to die necessarily, I don't want to kill anyone, though my ex is asking for it. And you might be sitting there thinking, sweet Jesus, how do I file a restraining order against this crazy bitch? And I can't really blame you, but let me explain how intrusive thoughts work. Most of us get them, but normal people leave them behind and they cheerfully get back to watching funny cat videos online. Now, if you have OCD, you will start picking each thought apart, and the next thing you know, you are stuck with a bunch of new rituals, 1, 2, 3, 4, 5, 6, 7, 8, that make you look like you are high on acid. And there is a part of me that knows all of this is utterly stupid and pointless, but giving in and, performing some witchcraft is always so much easier than having to face the terrible thoughts my mind projects. I'm 27 and I am scared to death if I leave my bathroom door open. I really like to be in charge, but at the end of the day I know I just can't stop.
That's kind of rough. Okay, what can you do to treat OCD? Again, pharmacotherapy is possible, SSRIs, MAOI inhibitors, and tricyclics. You can use other medicines adjunctively, anxiolytics for anxiety symptoms, and atypical antipsychotics for poor insight. And that's one of, when we're looking at schizophrenia, the antipsychotics are useful because they do help patients gain insight into what's wrong with them, their hallucinations and delusions. So you can use them here with OCD also. Behavioral therapy, exposure therapy to help in learning how to prevent ritualistic responses, and then combined pharmacotherapy and cognitive behavioral therapy are believed to be the best treatment. So medicines have their place, therapy has its place. Together is probably your best outcome for a person with OCD. I think this is interesting too. For severe treatment-resistant OCD, neurosurgery may help. Deep brain stimulation. And that would be out there and not commonly done. Okay. Any questions about OCD? Okay. Next.